All right, get ready to dive into a real medical mystery today.
Oh, I love a good mystery.
This one comes from the OpenStax Microbiology textbook. It's a fictional case study.
Fictional, okay?
Yeah, and if you want to read it yourself, you can find a link in the description.
Awesome.
So it's about this pilot. She's 40 years old.
Okay.
Her name is Carrie. And she gets these weird rashes whenever she's out in the sun.
Like a sunburn.
Not exactly. That's what's so strange about it.
Interesting. So what's different about these rashes?
Well, first of all, she's super careful about sun protection.
Oh, so she wears sunscreen.
Oh, yeah. Hats, sunscreen, the whole 9 yards.
Huh. And she still gets rashes.
Yeah, they're like these red raised patches, sometimes even scaly.
Wow. So you're thinking it's something more than just a regular sun sensitivity then?
Right. And to make things even weirder, they started showing up on her face, too.
On her face?
Yeah, like around her cheeks and forehead.
Okay. Yeah, that's definitely a little concerning. I'd be worried too if I were her.
So she goes to her doctor, her primary care physician,
Makes sense.
and the doctor's like, huh, this is weird.
Yeah, I bet.
So they run some tests, just basic stuff like urinalysis and blood work.
Standard procedure.
Exactly. Got to start somewhere.
Yay.
And that's when things start to get really interesting.
Ooh. The plot thickens. What did the test show?
Well, they found protein in her urine, which is called proteinuria.
Oh, okay. Not good.
And then there was hemoglobin in her urine, too. Hemoglobinuria.
Hemoglobin. Isn't that stuff in red blood cells?
It is. And to top it all off, her hematocrit was low.
Low hematocrit, so fewer red blood cells than normal.
Exactly.
So putting it all together, it sounds like she might have hemolytic anemia.
Whoa, hemolytic anemia.
Yeah, basically it means her red blood cells are being destroyed faster than her body can make new ones.
That's crazy from a sun rash.
It does seem a bit out there, right?
Totally, but why would the doctor think it's an autoimmune thing?
Ah, good question. You're picking up on the clues.
Trying to, haha.
Well, there are a lot of things that can cause hemolytic anemia, but in Carrie's case, with the rash and the test results, it's starting to look like her immune system might be attacking her own red blood cells.
Wait, so instead of fighting off germs and stuff, her immune system is attacking her?
Sometimes, yeah, it's called an autoimmune reaction.
That's intense.
It can be. The immune system is super powerful, and when it goes haywire, it can cause a lot of problems.
So what happens next? Does she get sent to a specialist?
Yep, the doctor recommends she see a rheumatologist.
A rheumatologist, don't they usually deal with, like, arthritis?
They do, but they're also experts in autoimmune disorders.
Makes sense, since a lot of those conditions can affect the joints.
Right, so there's a lot of overlap there.
Interesting. So Carrie's off to see the rheumatologist, but hold on tight because things are about to take a wild turn.
Uh-oh, what happens?
Before she can even make it to the appointment, she has a seizure.
A seizure? Wow, okay, that's serious.
Yeah, came out of nowhere.
Seizures can be caused by a lot of different things, but in her case, with everything else that's going on, it's a big red flag.
Totally. So she's rushed to the emergency room.
Yikes.
They tell the ER doctors everything, the rash, the blood tests, the whole story.
I bet they were scrambling to figure out what was going on.
And even though Carrie's not showing any signs of like joint problems or anything, the ER doctor calls in a rheumatologist right away.
Why do you think they did that?
Well, I guess with the seizure, on top of everything else, they're thinking maybe it's an autoimmune thing that's affecting her nervous system.
That's some quick thinking.
Yeah, they're connecting the dots.
Impressive.
So the rheumatologist gets there, examines Carrie, and they have a hunch. They think she might have lupus.
Lupus, that's a serious autoimmune disease.
It is, and it could affect a lot of different parts of the body. Skin, joints, kidneys, even the brain.
Oh, wow. So with the rash, the anemia, and now the seizure, it's definitely a possibility.
Right, so how do they figure out for sure if it's lupus?
Well, they run some more blood tests, but this time they're looking for specific things.
Like what?
First, they do an anti-nuclear antibody test, or ANA.
ANA, okay.
It checks for antibodies that attack the nucleus of the body's own cells, which is a sign of a lot of autoimmune diseases.
So if the ANA test is positive, does that mean it's definitely lupus?
Not necessarily. It could be other autoimmune conditions, too.
So they need to do more tests.
Right. They also do a Smith antigen test, or SEM test.
Okay.
That one looks for antibodies that are specifically targeting the Smith antigen, which is a protein found in the nucleus of cells.
So that one is more specific to lupus.
Yeah, much more so.
So we've got our two tests. What do the results show?
Drum roll, please.
Huh.
Both tests come back positive.
So it's lupus.
The ANA confirms there are autoantibodies, and the positive SM test strongly suggests it's lupus.
Wow, so Carrie has lupus.
It's a tough diagnosis, but thankfully there are treatments that can help people manage lupus and live full lives.
That's good to hear. So what's next for Carrie? What does life with lupus look like?
Well, that's a big question, and we'll delve into it right after this quick break.
All right, listeners, we'll be back in a flash to explore what it means to live with lupus. Stay tuned.
So we left off with Carrie getting this diagnosis of lupus.
Right. It's a lot to take in.
It is. So what does life with lupus actually look like for her? Like, what kind of challenges is she going to face?
Well, that's one of the tricky things about lupus. It can be really unpredictable.
Unpredictable how?
Like some people have mild symptoms that kind of come and go,
Okay.
and then others have like way more severe issues that stick around.
So there's no way to tell how it'll go for Carrie.
Yeah,
Got it.
unfortunately not.
So it's a wait and see kind of thing.
Kinda, but that's why it's so important for her to stay in close contact with her doctor.
So they can keep an eye on things.
Exactly. Like monitor her condition, adjust her treatment if they need to,
Okay, that makes sense.
and address any new symptoms that come up. Just stay on top of everything. So besides the rash and the anemia, what other symptoms should she be looking out for?
Well, lupus can be a real chameleon. It can affect so many different parts of the body.
A chameleon, huh?
Yeah.
So what else could she experience?
Lots of things. She could have joint pain and swelling, muscle aches, fatigue, even fever.
Oh, wow.
Some people even get chest pain, hair loss, mouth sores. It's a pretty long list.
Geez, that's a lot to deal with.
Yeah, it can really impact your quality of life.
I bet. And it must feel pretty isolating to deal with something so complex.
Absolutely. A lot of people with lupus feel like they're constantly having to explain their condition.
I can imagine. That'd be exhausting.
It is. That's why having a good support system is so important.
Like family and friends?
Yeah, and support groups, too. They can make a huge difference.
Yeah, to feel understood, right?
Exactly.
So we've talked about the physical symptoms, but what about the mental and emotional side of things? Like how does lupus affect that?
It's definitely a factor. Living with a chronic illness like lupus can really take a toll on your mental health.
Yeah, I can see that.
Anxiety, depression, even feelings of grief and loss, they're all pretty common.
Wow, it's a lot more than just physical symptoms.
Right. It's important for Carrie to acknowledge those feelings and seek help if she needs it.
Absolutely. So it's not just about treating the physical symptoms, it's about taking care of her mental health too.
Exactly. And lupus can also affect work, relationships, social life. It's a disease that touches every aspect of life.
So it's a real journey of adapting, huh?
It is. And speaking of adapting, let's talk about treatment.
Okay, so we know she's on corticosteroids and hydroxychloroquine.
Right.
But what other options are there?
Well, if she has a lot of joint pain and swelling, her doctor might prescribe NSAIDs.
NSAIDs like ibuprofen?
Yeah, ibuprofen, naproxen, those are common over-the-counter ones, but sometimes you need stronger prescription NSAIDs.
Interesting. I didn't realize those were used for lupus too.
They are, but for more serious cases, they might use immunosuppressants.
Immunosuppressants, those sound pretty hardcore.
They are. They basically suppress the immune system's activity.
And that helps with lupus.
Yeah, it can help reduce inflammation and prevent organ damage.
But wouldn't suppressing the immune system make you more vulnerable to getting sick?
It can. That's one of the risks.
So it's kind of a trade-off then.
Exactly. And that's why it's so important for Carrie to have open communication with her doctor.
To find that balance, right.
Right. They can help her navigate those decisions and find the treatment plan that's best for her.
Okay, so we've talked about medication. What about other things, like lifestyle changes?
Mm-hmm.
Can those help manage lupus?
For sure. One of the biggest things for anyone with lupus is managing stress.
Stress makes it worse.
It can. So finding healthy ways to cope with stress is really important.
Like what?
Oh, lots of things. Yoga, meditation, spending time in nature.
Yeah, those are good for everyone, really.
They are, but especially for someone with lupus.
What about diet and exercise? Do those play a role?
They do. Eating a healthy diet and getting regular exercise can definitely help.
But isn't it hard to exercise when you're tired and achy all the time?
I know, it can be. But even gentle exercise can boost your energy levels and make you less stiff.
So it's about finding that balance again.
Yep. Listening to your body and finding what works for you.
So with a disease like lupus, are there any long-term complications that Carrie should be aware of?
There are some things to keep in mind.
Like what?
Well, because lupus can affect different organs, in some cases, it can lead to some serious problems down the line.
Like what kind of problems?
Like kidney failure, heart disease, even stroke.
Oh, wow, that's scary.
It is. But with good management and early detection, the risk goes way down.
This is all about being proactive.
Exactly. Regular checkups and being on top of her health are key.
Okay, so what else should she be aware of?
One other thing to think about is that lupus can affect fertility and pregnancy.
Really?
Yeah. So if Carrie's thinking about having kids, she should definitely talk to her doctor about the risks and what precautions she can take.
That's a good point. It's not something you'd necessarily think about.
Right. But it's important.
So managing lupus is a whole journey, huh?
It is. It involves medication, lifestyle changes, emotional support, and staying informed.
It's a lot.
It is, but with the right knowledge, support, and medical care, it's definitely manageable.
Well said. We've covered so much today.
We have.
But I'm curious about that hydroxychloroquine you mentioned earlier.
Yeah.
It's got a pretty interesting backstory, doesn't it?
It does. It all starts with a tree.
A tree.
Yep, the cinchona tree.
Okay, I'm intrigued. Tell me more.
We'll save that story for the next part of our deep dive.
All right, listeners, get ready to travel back in time with us. We'll be back soon to uncover the surprising origins of hydroxychloroquine. Okay, so let's dive into that hydroxychloroquine story you mentioned.
All right, are you ready for a little trip back in time?
I am. Take me away.
All right, so it all starts with a tree, the cinchona tree.
A tree, huh? I'm intrigued.
It's a pretty special tree native to South America,
Okay.
and it produces this compound called quinine.
Quinine, that rings a bell.
It's been used to treat malaria for centuries.
Wow, malaria. That's a far cry from lupus.
It is, but that's how it all started.
So how did we get from a tree in South America to a drug for autoimmune diseases?
Well, scientists kept studying quinine, and they discovered it also had anti-inflammatory properties. And that led to them developing synthetic versions of quinine, like chloroquine,
Okay.
and eventually hydroxychloroquine.
So we went from a natural remedy to a man-made drug.
Exactly.
When did hydroxychloroquine come about?
It was first synthesized in the 1940s.
In 1940s, wow.
And it quickly became a go-to treatment for malaria.
Makes sense.
But then researchers started noticing something interesting.
What's that?
It seemed to be helping with some autoimmune conditions, too.
Like lupus.
Lupus, rheumatoid arthritis, those were the main ones.
It was kind of a lucky break.
You could say that it's a great example of serendipity in science.
I love those kinds of stories.
Me too. It just shows you never know what you're going to find.
Right. And now this drug that was originally for malaria is helping people with lupus.
It's pretty amazing.
It is. And speaking of unexpected uses, I heard hydroxychloroquine is being studied for other things too.
Oh yeah, it's being looked at for some viral infections and even some types of cancer.
Whoa, viral infections. That's a big leap.
It might seem like it, but remember how we talked about hydroxychloroquine messing with antigen processing?
Yeah.
Well, that same mechanism can disrupt the replication cycle of some viruses.
So it's like stopping the virus from spreading.
Basically, yeah.
Wow. So is it being used to treat viral infections now?
Not quite yet. It's still being researched.
Okay.
Some studies are showing promise, but we need more research to be sure.
Right. Better to be safe than sorry.
Exactly.
But even if it doesn't end up being a big breakthrough for viral infections, it's still a pretty remarkable drug.
It is. It's a reminder that even simple medications can have really complex effects.
And who knows what other uses we might discover for it down the line.
That's the beauty of science. There's always something new to learn.
Well said. I think we've covered a lot of ground today.
We have, from a mysterious rash to the history of hydroxychloroquine.
It's been quite a journey.
It has. Thanks for joining me on this deep dive.
And thanks to you, our listener, for tuning in.
We hope you learned something new and interesting today.
And if you want to learn more about lupus or any other autoimmune diseases, there are tons of resources available online.
Definitely don't be afraid to do your own research and learn more.
Until next time, stay curious and keep exploring.
See you then.